Today, let's talk about effectiveness and safety of P2Y12 inhibitor pretreatment for primary percutaneous coronary intervention in ST segment elevation, myocardial infarction, systematic review and meta-analysis. Dual antiplatelet therapy with aspirin and P2Y12 inhibitors in patient with ST segment elevation, myocardial infarction has been shown to be associated with better outcomes. Yet, there is uncertainty regarding the optimal timing for its initiation. A systemic review and meta-analysis of evidence on pre-treatment with P2Y12 inhibitors in combination with aspirin in patients with ST segment elevation myocardial infarction undergoing primary percutaneous coronary intervention. A systematic search of electronic database PubMed, Central, and Scopus until April 2022 were performed. Studies were eligible if they compared P2Y12 inhibitor upstream administration with downstream use in patients with ST segment elevation myocardial infarction submitted to percutaneous coronary intervention. Studies with patients receiving fibrinolysis or medical therapy only were excluded. Outcomes were assessed at the shortest follow-up available. Of 2,491 articles, 3 RCT and 16 non-RCT studies were included with a total of 79,300 patients. Pretreatment was associated with reduction in definite stent thrombosis, all-cause death, and cardiogenic shock. It was also associated with a lower incidence of thrombolysis in myocardial infarction flow less than 3 pre-PCI. However, incidence of recurrent myocardial infarction was not significantly reduced. Regarding safety, pretreatment was not associated with a higher risk of major bleeding events. To conclude, pretreatment with dual antiplatelet therapy, including a P2Y12 inhibitor, was associated with better pre-percutaneous coronary intervention, coronary perfusion, lower incidence of definite stent thrombosis, cardiogenic shock, and possibly all-cause mortality with no sign of potential harm encountered.